Hi everybody, warriors, warrior princesses, new warriors and warrior princesses. I see you've returned for your, for your cranial nerve exam. So let's get this started and see exactly what you have going on, okay? Okay. Really on the sleeves, yeah, because we're gonna really get into this, okay? Okay, now, what I'm gonna do is I'm gonna start you off with a detox, just to purify your blood a little bit before we get started, okay? And I'm gonna need you to drink this, okay? Okay, and I'm gonna start with this, and what we're gonna do is I'm gonna open it up for you, okay? And we're gonna, yeah, okay, alright, and I was prepared for you, so it smells really good. Okay. Okay. I'm gonna drop it into here. Okay. Yeah. Sorry. I'm ready. Okay. We're gonna take this one and we're gonna put it into here. Okay. And then we're going to take the second one because I want you to take 2 of these because we really want you to be strong for this, okay? Okay, it's very important. Okay, this is the second one. And what this actually is it's made from dandelions. And it's gonna purify you. It has, let me see, hold on. Yeah, it's all dandelions. I know what's in it. I made it. Yeah. I got the ingredients from Alchemist Amiki. Okay, here you go. Here, we're gonna take this one out. Okay. Let's see. And I'm actually doing it, and I'm actually spelling it for this. I'm putting a spell on it for you. Charging it. That's what I was trying to say. Okay. Are you ready? And somebody said I was high on my last video. I'm not high. Okay, ready? Here we go. Now what we're gonna do is gonna take this, put it to the side, and then I'm going to put in the second tea bag for you. Okay, now we're gonna let that steep for a moment. And I'm going to start your exam now. You'll notice. Okay, I'm putting the little one. Okay, there you go. Okay, now, last time you were here, I gave you an ingredients list. Do you remember? Okay, well, I see that you took the ingredients to Alchemist Amiki, and you've come back with a list complete. Okay, on the list we had werewolf hair. Check, you got it. Okay, and we do have that. Goblin toenails. Check. Very good work. I'm very impressed that Alchemist Amiki was able to get these things together for you at such a short notice. It's really nice. It's kind of him and he did a wonderful job. Okay. Dried vulgaris. Dried. Okay, we have it, don't worry. Fresh spice Amiki. Okay. And ground unicorn bone. He goes to a unicorn graveyard, so there's no unicorns were slaughtered or anything for this. Okay, here you go. And garlic. Very good. Very nicely done. Yeah. Werewolf hair. Hold on. Goblin toenails. Dried vulgaris. Dried Amiki. Fresh spicata. Something. Okay. Okay. Ground. Okay? And what I'm doing right now is I'm charging the ingredients list. Okay? Okay. Now, what I want to do first is I want to start you off with an eye exam. Okay? Okay. I need you to sit down and relax. Just get yourself very comfortable. Are you comfortable? Okay. Very good. Now, what I'm going to start with is a color exam, okay? Now, what I'm going to do is, okay, let's get you some of that tea so you can relax while you're sitting here, okay? Okay, here you go. Ready? Enjoy. So loud. That's much louder than the blood orange, isn't it? Okay. Now, while you're drinking that, I want you to be very careful with it. It's very hot, okay? Okay. Now, we're going to start with a color exam. Okay, what I have right here is these have been purified. Okay, and they're special. Yeah, I'm going to open them for you. Okay. Now, these are purified pine. Okay? Yeah. Okay. Now, take your time and sip on your tea. Okay? Make sure that you're very comfortable. Alright? Okay. Very good. Now, I'm going to take these out and we're going to dispose of this because this is a cranial exam. Yeah, we want to keep this in the room. Okay. Now, these I'm going to use to give you a color test. Now, first thing I need you to do is I need you to look right at me, okay? Firstly, I want you to tell me, how many fingers am I holding up? Okay. How many now? Okay. Now, how many now? Okay. Okay, you've passed that part of the exam. You did a wonderful job on that part of the exam. Very impressive. Now we're going to check your peripheral vision. Okay. There you go. Okay. This one eye. And can you see everything okay? Okay, you can see me fine? Okay, let's try this side. Huh? Okay. You'll notice that I have this with me. And this is a microscope because what I'm going to be doing tonight is I'm going to also be checking you for parasites. You were in the jungle, and so I just want to make sure that your blood and everything is clean, okay? Which is also why we're detoxifying you, okay? Okay, but let me just move this for a moment, okay? And okay, here we go. let's get back in on your peripheral vision again. Okay? Okay. Here we go. Sorry. Okay. And here we go. Okay. Here we go. Very good. Okay, you're doing great on this. Okay, now, the color exam is going to come into play, and that's very important. And it's very important because I want to make sure that you didn't go colorblind at some point, and checking for colors. Make sure you can see colors. This is a huge part of this exam, okay? Very good. Okay, here's what we're going to do. We're going to open this up. Or not. Okay, yeah, I got it. Okay, now, this is a very important part of the exam. These are pods that I made. And these are actually pods of color that I made, and they're made from different stones and gems and crystals in the woods. Okay. Okay. Here we go. This is this particular. Okay. Very important. Yeah. Very important. I'm opening it now. I'm gonna use my spell. Hold on. Okay. I got it. Okay. Now. Are you ready? Please continue to just relax. I want your body completely relaxed. It's very important that you relax because this way, okay, we can get an accurate feel for exactly what's going on with you. Okay. Okay. Now, first color. I really want you to be able to, okay? Now, this is important. Are you ready, warrior? And warrior princess is okay. Here we go. Alright. Now, these are okay, it's actually beautiful. Okay. Tell me, what color do you see? Okay. Now I want you, what I would like you to do is I would like you to actually put your hand over your left eye. Put your hand over your left eye. Okay. Oh, that one. Okay. There. Okay. Alright. Now of your right eye. Okay. And what color do you see? Okay. Blue. Very good. Very good. Okay. Alright, now, here's what I want you to do. Okay. Put that there. Because we're going to be doing some other stuff for that. Okay. Now, I want you to do the same exact thing as you did for me before. Okay, what I want you to do is, I want you to put your hand over your left eye. Okay? No. Okay. Do you have your hand over your left eye? Very good. Okay. Now, what color do you see? Very good. Now, put your hand over your right eye, please. You're doing so good. And theme. Okay, very good. Now, the reason that was absolutely so important was because greens and blues, color blindness really comes into play there. And if you were in fact colorblind, you wouldn't be able to tell green from blue, and so, okay? You did an excellent job on that part. Okay, how's your tea? Okay, very good. Okay, would you like some more? Okay, here you go. Hold on a second. Now, we're going to, here you go. There you go. Okay. Now, what I would like to do as well is some more eye exam, okay? Now, that's gonna come in the form of two more and very important colors, okay? And these are your basic, it's very basic, and yet, you know, I don't know if you can't tell these apart, but you did so great on the blue and green. That was so impressive that, you know, I can't help but think that I'd love if this would be easier to open. Okay, we're gonna, I'm magic. You see? Okay. Okay, ready? Now, once again, I would like you to tell me how many fingers I'm holding up. Okay. You're doing very good, so I just want you to relax, okay? No, you're doing very good. There's nothing to fear. Okay? Okay. Now, part 2 of your eye examination. Okay, here we go. Okay. Mm-hmm. I have to mix up. Okay, it's yeah. I made this from the white of a robin's egg, and so I overcooked it. Okay, anyway, we're okay. You can tell. Okay. What I would like you to do. Put your hand over your left eye. Very good. What color do you see? Egg white? That's exactly right. Okay. And now put your hand over your right eye. Okay. Do you see the same thing? Still? Look. Okay. Me too. Okay. Very good. Okay. Now. This is on to the next color, okay? You know, I just want to make sure, like I said, that your color, that your vision is fine, okay? As far as color goes. So we're gonna dive into one more color. Not div. Okay, ready? Okay, here you go. Put your hand over the left side, warriors. Okay. Okay. Yeah. Okay. Are you ready? Okay. What color do you see? Very good. Okay, and can I bother you to please put your hand over your right eye and tell me what color you see from there? Okay, very good. So, with that said, what we're going to do is I'm going to pass you on. Very good. Very, very good. It was actually very impressive. So I'm going to pass you on that portion. Okay? Now. Okay, and I'm going to write here that you passed both the count, the focus, and the color code test. Okay? Okay, so you passed all 3 of those. Count, focus, and color. Very good. 100%. first part of your test has been passed. Okay, you're 2 steps away from your pass, you're here to get a certificate so that you can go into battle. You're 2 steps away from that, okay? Okay, now, the second part of the test is going to be olfactory, your nose, okay? Okay, now, I'm gonna put my color palettes to the side, okay? There's a little dry down here, so you're gonna hear me sniffle once and anybody, if you haven't seen my videos before, I get a little thirsty sometimes, okay? Alright, can I have some of your tea? Thanks. You guys rock. Okay. So sorry. Okay, now, here's what we're going to do now. What I need you to do. I really, really want you to relax. Okay, be super calm. Just relax, okay? Okay. Now, what we're gonna do is we're going to check, as I said, your sense of smell. Now, you are warriors and we're princesses. So the smells that I chose for you are nothing average, okay? I'm expecting that you'll know these smells because you're warriors and we're princesses, okay? Okay. Now, close your eyes. What I want to do first is I want to calm you down. I want to relax you, okay? Relax. I'm just playing with your hair right now, just brushing it out of your face, okay? Here you go. Her hair's very dry. Okay. There you go. Oh, very good. Okay. Now, I want you to calm down and I just want you to completely relax. Take solace. You passed the first part of your exam wonderfully. Okay. Now, what I'm going to do is I'm going to wave this under your nose and I want you to tell me what smell it is. And as I said, you're warriors and we're princesses, so we're not going with the norm. Okay? Okay. Close your eyes. Okay. This one is going to be the first test of your olfactory. Okay, here we go. Okay. Okay, what exactly do you smell? Flowers? Jasmine flower? See, I knew you would know that. That's excellent. Very, very good. Okay, now, very good. Now, on to the next scent. Alright, are you ready? Okay, and once again, I want you to completely relax. And I'm gonna wave this underneath of your nose. Okay? Okay. Alright, now this one here. Okay? Yeah. Oh, I love this. You will too. You know it already. I know you do. Okay, ready? What I'm gonna do is I'm gonna clean the air in your area. I'm gonna clean the air in the area to just get any smells out that were previously there so that you don't get your smells mixed up. Okay? Okay. Now, okay, here we go. Are you ready? Close your eyes. Okay, very good. Okay. Yeah. Okay. that smell to you? Very good. Exactly. It's a woodsy kind of smell, isn't it? It's got essence of wood in it. It's a centralizing smell, and it is patchouli. Very good. It has a very earthy smell to it, I think. Doesn't it now? Here. Very good. Okay, you're well on your way to passing part 2 of your test. Okay. Now, what else I'd like you to do is finish the sentence up, okay, with closing your eyes. And we're gonna come back in. There you go. Let me clean the air for you. Okay? Okay. The next smell. Close your eyes. Completely relax. Okay. Ready? Now this one. This one is very powerful, so yeah, I would you'll know it though. It's hard to miss. Here, you ready? Okay, right under your nose. Okay. Okay. I don't want to leave that one there too long because it is quite a powerful smell. So. Okay. Okay, flowers. Okay, yeah, very good. And this one. This one is a comforting smell. This is geranium. So you're doing very well. You're actually almost halfway through the second part of your test. Okay? Very good. Now, this is the next one. This is the fourth. This is the fourth and final scent test. Okay, now lay back, relax, close your eyes. Completely just relax. Okay? Okay, very good. Now, I'm gonna do the same as I did with the others. Now, let's clean the air once again. This is, what I did was I actually made this as, to clean your wounds as well. It dual tasks as a wound cleaner and a air cleaner. Okay. Ready? Now what we're gonna do is we're gonna clean the air. Ready? Okay, let's get that done. Okay. And as I said, because it's so good to also clear your skin, it's really good for us to have this in the air right now, okay? Now what we're gonna do is the fourth scent. Are you ready? Yeah? Okay, let's do it. Close your eyes. Relax. Okay. Okay, here we go. Alright. Alright, now this one is very important because if I have to do anything during this exam that requires the surgery, I will also be able to use this to like clean, and you'll see. I don't want to tell you though, because I guess what it is. Alright. Okay, ready? Okay. Close your eyes, and I'm gonna put it under your nose. Here we go. I was making sure my label wasn't facing you. Okay, here you go. There you go. Uh-huh. Very good. And you're also have a sensation with that, don't you know? Yeah. Well, that's because this is eucalyptus, and it's exhilarating, and people use it for all kinds of things. It's very good. Okay, very good. So this is good. You have passed. Can I have some more of your tea? Thank you. That's good. Do you like it? I do. Okay. So, let's write this down. You have passed the 4 code test. 4. Okay. 4 cents. Test. And that is for olfactory. %. Very good. That's really good. You're doing so great. Very good. Now, next what we're going to do is a taste test. Okay? I have a few items here. And they were also on the ingredient. Oh, no, they're not. No, they're not. No, they're not. Just don't. Never mind that. Alright, never mind. But I do have items. Okay. Alright, you ready? That smells so good. I love the ways like spices and stuff smell. And my mystical ingredients. I love it. Okay, here we go. Now, what I would like you to do is close your eyes and open your mouth. Okay? Okay. Okay. Here you go. I'm gonna slide this in and don't look. Close your eyes. Okay, close your eyes. I see you're peeking. Okay. Here you go. Okay. Tell me what you taste. Okay. Alright, very good. Very good. That was in fact an onion. Sorry. I had the check, you know. Okay, now next, what I have for you is, that's just a little piece. That's good. It is good, you like it? I will for you. Okay, now what I want you to do, trust me, close your eyes. Okay. And I'm just gonna take a little tiny piece of this out. No, you can't see what it is first. Okay. Open your mouth. Okay. Alright, here we go. And, okay. Here you go. Okay, you're giving me a hard time. Why? Okay. What do you taste? Lemon? Well, you know, I really just wanted to go from one extreme to the next, and so I just wanted to be sure that everything was good with you. Okay, very good. Now, we have one more thing I would like you to try. Okay? How's the tea, by the way? Here, have some more. Thank you. Oh, here. We're sharing the same cup. Okay, now Okay. Now, you know the deal. Close your eyes. Completely relax. Very good. Just let your head fall back on your pillow and just trust me. Well, not too far. I don't want you to joke. Okay. In the chair. You're in my chair. Okay. Did you see that? Hold on. Okay. Good. Okay. Now, close your eyes. Close your eyes. Okay. Open your mouth. Okay. I realized why you were giving me a hard time before, because I was putting it in your cheek. Okay, here you go. Okay? Alright, very good. Now, tell me what you taste. What is that? Okay. Okay, right. It was garlic. But, okay, see, I had to give you that because I want to make sure that some of you aren't infected because you did come into contact with vampire sloths, and so I'm just doing the right thing. Okay? Great. Okay, now we're going to come back here, and what we're going to do is by the way, you've passed 100%. There is a problem though. Hold on. Olfactory. Okay, on the olfactory, you passed 100% for comforting smells, centralizing smells, and okay, all of it. There's another one, jasmine, and I thought there was something else. Oh, here you go. And exhilaration. Okay, so you're in very good shape with that. Wow, that is just completely, that's impressive. That's really, really good because each of those scents has a different reaction on your mind, and as I said, you passed for centralizing, comforting, and exhilarating. Very good. And let me write that down. Okay. You passed for centralizing, comforting, and exhilarating. Okay, 2 thumbs up. Way great. Okay, we do have a problem though. You're here because you can't sleep, so I'm thinking that there's something rattling around, and so we're gonna get a check. Now, what I'm going to do is sniffle. Sorry. Okay. Now what we're gonna do is I'm going to check your head. Okay? And I'm going to use once again these are sterilized. So you don't have to trust me that you don't have to worry. They have been sterilized. They are in a sterilized case, which I myself have personally sterilized as well. Let's don't jeopardize you. Okay? Okay. Now, what I need you to do is I need you to relax, and I'm going to prepare also the ingredients that alchemist Miki gave to us. Okay? Okay. Now, first things first, what we're going to do is we're going to start here. Okay? I'm going to set a soothing environment for you, and I want you to completely relax because I want to look around. Okay? That's pretty. Okay, you don't want that weird translate. Okay. Yeah, I got it. Let me roll up my sleeves because, you know, I'm really gonna want to get in here. Okay? Okay. Relax. Very good. And how do you feel? Yeah? Great. Okay. And what I'm gonna do is I'm setting the stage right now to further sterilize any equipment that I may be using. Okay? Very good. Okay. 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 Alright, here we go. Ready? Okay. And here. Good. Start that there. Very good. Okay. Okay. And what I'm gonna do. That's really a happy flame, isn't it? Okay. Now, what we're gonna do is we're going to move this back just a little bit because I'm going to need to be able to reach you. Okay? Oops, sorry. Okay, you ready? Okay, then we're gonna put this, let's see, in a place where I would like you to be able to see it. Do you hear the noises of our area? I love having you here. It's so great, and I'm so happy that you've passed your exam. Okay, you have your certificate to go into battle. Okay, have a sip of some tea. Yeah, cause I'm getting a little dry over here. Okay, now let's see if we can. There you go. What I want to do is I want to rise this up a little bit so that maybe I can get the flicker of the flame in the lens for you, and it can comfort you. Okay, that's what we're gonna do here. We want to comfort you. Okay, well, let's see if we can do that. How's that? Oh, there it was. Okay. Kind of. Okay. It's a happy flame, so you can really see it. Okay. Now, oh yes, back to your head. Now, what I'm gonna do is going to disinfect this. Okay. Not only by flame, but by this mystical powder. Okay. Okay. You can see? And I'm actually. Okay. There you go. And I've actually put it into here. And how is your hearing? Yeah? Okay. Now, I'm gonna remove this because you're not seeing the flame. So what we're gonna do is I would like you to hear this as I make it so that you know that it's actually working, okay? Now, as everyone knows, citrus is wonderful for antibacterial and, it's very good to clean. It's a wonderful natural cleaner. Okay? Okay, here we go. Now, what I'm gonna do is I'm gonna put this here for you. Okay? And here we go. almost done. And it's made of peroxide of sorts. Can you see it? Oops. Oh, hold it over here. Here you go. Can you see it? And what I'm going to do is I'm going to take this and I'm going to put it on your one side of your head. What I'm doing right now is I'm looking inside of your ear. Your insomnia seems to be caused by, it's a localized area. It's on one side. I can see that your pupil is slightly more dilated on that side. So what I'm going to do is I'm going to ask you to tilt your head slightly left, okay? And I'm going to go in and I'm going to go ahead and check the right side for you. I'm going to go ahead, look inside your ear, okay? And you're going to hear me moving your hair around a little bit, okay? Now just relax. Hold on. Let me. Okay. Oh. Oh. Okay. I see the problem. Hold on. We've got it. It's not that big of a deal. Okay? And what I'm gonna have to do is I'm gonna have to do a minor extraction. Okay? Now, this is where the sterilized. It's gonna come in handy. Okay? Just relax. It's not gonna hurt. You've been completely. What I'm gonna do. Okay. There. I'm gonna add a little bit of this. This is the eucalyptus, and what that's going to do is that's going to slightly anesthetize the area. It will. I've enchanted it. Hold on. I'm enchanting it right now. Look. Oh, wait. Okay. Here. Here you go. Slightly there. And you just coast your hand over it. And there you go. And the enchantment has begun. Okay? Now I'm going to come in. Okay? I was just looking at something. Okay. Open this up. Okay? Now. Okay. Oops. That was deodorizer. Okay. Now. Come here. Okay. Okay. Alright. Let me see. What do you have here? Okay, hold on. No big deal. Okay, see? It's the eucalyptus that we're using. Okay? I heard a dragon outside. Okay. Okay. Okay, here we go. Alright. Come here. Just relax. Okay. Alright. Let me put this under your nose a little bit as well. Would that be okay with you? Okay, great. It's really going to help you a lot. It's going to be an antibacterial. It's going to anesthetize. It's going to completely relax you. Well, it does exhilarating. What do I have? Oh, here. I have something to relax you, but let me put this on your head first. Okay, hold on. Now, as far as you go and your well-being, okay, what I'm going to do is I'm going to put a little dab of this underneath of your nose. Okay? Great. Okay. Now this one is comforting, and this one has no. Okay, this one actually has bergamot, chamomile, and cedar. Okay? Okay. You close your eyes. Here. Ready? 1, 2, 3, 4. Ooh. Okay. This 4 is perfect, don't you think? And what we're gonna do, come here. Put it under your nose. Okay. Oh, excellent. Okay, close your eyes because this is going to be a minor surgery. It's not going to be anything that's going to hurt you, I promise. Okay? Okay. Close your eyes. Relax. Okay. Here we go. Right under your nose. Very good. Okay. And there you go. Oh, excellent. That's very nice. That smells good. Okay. Now, what we're gonna do, don't be scared, it sounds worse than it is. I swear. Okay, you ready? Now, I've got your hair to the side. What I'm gonna do is I'm just gonna shave off a tiny bit above your ear. What I'm actually using to do that is my charmed and enchanted stones that if you watched my video last time, then you'll know what they are. And you saw me sharpen them, so they're quite sharp. No need to worry, okay? Okay. Okay, here we go. I'm gonna sharpen a little bit more for you. Okay, now here we go. That's a dragon. He's been out there like... yeah, okay, let's do this. Now come here. Okay. Lean your head and slightly. Okay, very good. I know if you get uncomfortable at any time, please do not hesitate to tell me. I am here to make you feel better. Okay? Okay, here we go. Now come here. That's not gonna hurt. Now. Okay, now. Is that comfortable for you? Okay. Alright. Very good. Now, what I've done while I was doing that was taking the small amount. I also grabbed a sample, okay? So that we can tell exactly what's wrong with you. Okay. Okay, let's do this. Here we go. And I'm going to kind of do this, and what I'm going to do is I'm going to look into here, and I'm going to see exactly what I've gotten. Okay, and this microscope, you know, it's all enchanters have one. You should too, so you can, you know. Okay, ready? Okay, now, and here I go. I'm gonna look into it, and when I look into it, I'm gonna be able to actually tell what's kind of inside your head that is keeping you awake. And what I'm going to do is this, I'm going to go ahead inside and we're going to take it. It shouldn't be too far in. It's, again, as I said, it's a minor surgery at best. Okay? Okay, here we go. Okay. Okay. Oh. I see the problem. Oh. Look at that. Okay. Oh, let me pull back. I'm pulling back a little bit just to be sure that I'm 100% right. Because this isn't... It really, truly is a minor surgery. But, you know, if you keep it in there, it's a big problem. Hold on a second. Let me take another look. Okay. Uh-huh. That's definitely what it is. Unbelievable. You should see this thing. I'll show it to you after I extract it. Okay? Hold on. Oh. Unbelievable. No. And a big deal. Let's get it. Okay? Okay, here's what you have. I think you're gonna be quite surprised, actually. Let's start the extraction process. Huh? No. It's not going to hurt. Please don't be nervous. I'm gonna hurt you. I'm trying to help you, okay? Very good. Okay. Here we go. I'm gonna put this to the side. I want to be able to reach you and touch you, like, you know. Okay, I can't touch you, things in the way. Okay, now, what I'm going to do is I'm going to take this paste here. Okay. I'm going to be using the sterilized sticks here to extract it. Okay. Ready? Here we go. Once I've read them, keep your heads tilted slightly. Very good. You're doing very good. I think this is going to solve some problems. And you know, the thing is, you'll be even more prepared for battle, so it's only going to help. Okay? Okay. Peace out. Okay, and again, I will dispose of the paper to keep the environment as clean as possible. This is medieval times, you know, so, you know. Okay. Okay, we're good. Are you ready? Tilt slightly. Completely relax and tilt slightly. Okay, very good. I'm not sure what that was. Okay, here we go. Okay, let's see. What I'm going to do is I'm going to use some of this mixture. I'm going to use some of the lemon mixture that I made. Okay? Sure. Oh, absolutely. That is exactly what this is for, so absolutely yes. Let me also prepare the area a little bit better. This is anise. It works good. Hold on. Come on. Alright. And I put it in a special mystical, this is a glass cylinder, and this is a crystal stone in there. Okay? Here you go, come here. And let me rub this crystal at the back of your ear along there you go. Okay, great. Okay. Okay, very good. Wait. There you go. That's the kind of sound effect we're looking for to, like, you know, relax you. Okay, now for this. head tilted slightly. Very good. Very good. Okay. I don't want you to be upset when you see. I am going to show you when I pull it out. Don't be upset, because you know you should be glad we got it out. Okay. I'm gonna clip a little more hair from here. Okay. Okay. Alright, just push it out the way and make sure the area is completely. Alright. Yeah. And then, okay, once again, wipe it off. Okay. Okay. Now, are you ready? Okay, completely relax. Solution is prepared. Going to go in for the surgery. We only need to go in. Okay. Are you ready? Okay, here we go. Okay. You should hear like a very like muffly kind of, you're gonna hear something in your ear, only for a moment, okay? But where I'm actually at it, like right above your ear, okay? So I'm not actually inside of it. We're kind of going in, but exactly right above it, okay? Now I'm gonna need a glass of, actually, let me prepare for this, because what I'm gonna need to deal with this creature is I'm gonna need some mystical water, okay? Okay. And the air, it's very dry down here, so have some more of your tea. There you go. Okay. There you go. It's good. Very good. Okay. Ooh. Mm-hmm. Okay. Now what I'm actually going to be doing right now is I'm going to come in this glass, and I'm going to create a spell to, as soon as this hits the water, it will, move to the other side, it kills it, okay? Okay. And that's very important, because we don't want any returns on this now, do we? No. Okay. You ready? Okay, here we go. Here's what we're doing. And I'm going to take this water, like so, and I'm going to cast a spell on it. Okay? And I don't know if you can see, there you go. And that's the spell that I've cast on the water. That's magic. Okay. There you go. Here we go now. What we're going to do is, now I'm prepared to extract. Okay, just relax. I'm enchanting these before I do it. Now, here we go. As I said, please do not be upset. It's not a big deal. It actually happened to me before. Okay? Okay, but here you go. And I'm taking it out now. Look at your head. Okay, we're in. Okay. Wait a minute. Okay, just let me know if you're. Please let me know if you're. Please let me know if you're uncomfortable at any time. Okay, that's very important. Okay, you should be relatively. Okay, here we go. I'm sorry. Okay. Wait. Oh, alright, guys. I got it. You had a fireworm in your ear. We're gonna kill it right now. Look at this thing. How horrible is it? Look at it. You see it's trying. It's dying. It's dying. It's dying. Can you hear it? Listen to it, you should hear it. I don't know if you can hear that or not. Yeah, okay. That's dead. I'm sorry. I'm just laughing because you seem so upset. I specifically told you not to be upset. Don't be upset. It's kind of funny that you're upset because it's, I don't know why. Because it's really nothing to be upset about. Now, because what I'm going to do now, this is the part that, what I want to do. Hold on. Let me put something on it. Okay, hold on. Okay, this is therapeutic. It'll put you in a positive state of mind. And then we're gonna come in and do this. Hold on. Ready? Okay, there you go. Okay, now what we're gonna do okay. There you go. Now hold on a second. There's a peasant in the thing. Okay, now what I'm gonna do. Did you hear the peasant? Okay. Okay. They're probably just going somewhere strange, who knows? Okay. Now there you go. Sorry about that, but as you could tell, the peasant distracted me, and let's move on. Okay? Okay, great. Now, let's treat this, okay? Are you ready? I'm just gonna put it over there. Your hair is rather dry. No. Here, I'll put some moisture on it for you. I'm fine on the talk, aren't I? Okay, here. Come here. Me too. Oh, the bracelets. I'm sorry, hold on. Okay. And this is all the cleaner that I used earlier to clean the air that I said was a wonderful disinfectant. Okay? Okay. Sorry. That peasant was really distracting me. It's like a villager mulling about our kingdom. And you know, when you're trying to do surgery, you know what I mean? I just really want to be focused on you. Okay? Okay. Now, we've extracted your fireworm. Oh, let's give you your certificate. Because, okay, here we go. Excellent, excellent, excellent work. Now, yeah, 100% eye exam. Very good. 100% olfactory. Okay, boom, boom, boom. Good. And the Fireworm is out, done. Clean bill of health. And what we've done is we've actually went ahead and cleaned that area. It's all disinfected. Okay? And you're gonna relax now. And basically what I'm going to do now is I'm going to go ahead and I'm going to bathe you in some pink light, and I'm going to hypnotize you, because what I want you to do is I want you to completely relax, and I want you to heal. I know the fireworm in your head. It had to be annoying, but you know, hey, you guys are my warriors and my warrior princesses, so that sort of thing is gonna happen. And there goes the village again. Okay, let's just keep talking over them, shall we? Okay, now, okay, here we go. Okay. Do you hear it? Okay, let's just pretend we don't. Now, you've passed everything. 100%. Very good. Now, you've earned your certificate of, you know, you're able to go into battle. I'm sorry. Okay. Okay. Now what we're gonna do, what I want to do real fast, I have the ingredients that, you fetched for me from Alchemist Mickey. Okay? Okay, now let's do that and you know, mix those up, and what I'm gonna do is those are gonna be prescribed, and those are prescribed to you, and you're going to take those over the course of the next week, and I would like you to take your first dose while you're being bathed under 11 light. Okay? Excellent. Let's do it. I'm so proud of you. You did really good. Excellent. Now, the ingredients that you got from me from Amiki. Okay, let's start with werewolf hair. Okay, let me close your things so that they stay sterile. Okay, I'm actually gonna add a few dashes of these oils to them as well, just to keep you like in a really great place, okay? And what I'm gonna use is, I definitely want to use comforting. Okay? Okay. Let's start with the werewolf hair. Okay? Okay. I'm really sorry about that. That's the charm that I'm going to be hypnotizing you with it. Okay? Okay. First thing first. This is werewolf hair. See? I know it looks a lot like a fur comb, but it's not. It's werewolf hair. Okay, werewolf hair. First ingredient in werewolf hair. Now, second ingredient in is goblin's toenails. Okay. Now, Alchemist Mickey was fine enough to give us a full set. Goblin's toenails. 1, 2, 3, 4. Look at that thing. And 5. This is from the big toe. Okay. Okay. Yeah. Dried vulgaris. Yeah. Okay. Hold on. Okay. Alright. Now. Hold on. And from here. Okay. Okay. And then pour it in. I'm going to pour it into here. Sorry, I slipped on. Okay. Okay. Dry. Oregano. Let's put that in. Okay. And fresh spasada. I guess that's how I say it. There you go. Good. Okay. Very good. Now, the little sound you hear is me crossing it out the list so that we don't get things confused, okay? Because the lights are about to go and it's gonna get pink in here real soon. So I want to give you this, and I'm going to begin to hypnotize you under a soft pink light. You're a baby I love. Okay, now. Here's another ingredient that you might find interesting. And this is ground unicorn bone. Okay, now here we go. Let me move the thought. Here's, look. Done. Done. Don't even worry about this anymore. Don't even, look at that. Don't even, look, here. See? Ugh. Yeah, you don't even have to worry about that. Your head must feel so much better, to tell you the truth. Okay? Now, here's what we're gonna do. I'm gonna pull this over this way, okay? Yeah? Okay. Here you go. And we're gonna keep it nice and quiet. And then after I'm done, I'm gonna go shoot that peasant villager. Would you one of you like to go get them? Please? Okay. I shall supply you with any magic you might need, or, bow and arrow works great too. Okay. Okay, here we go. Now, here you go. This is the unicorn bone. Hold on. There you go. Yeah. I'm just gonna put that in here. Sometimes I work with, weird faces I make. Here. Don't worry about it. Here. Okay. Now, what I'm gonna do is going to add some more of this. I'm gonna measure it. Oops. We're gonna measure it in, and I'm gonna need just
just the right amount, okay? And so here we go.
Alright, now. Okay. Here you go. Yeah, this is about how much we want right here. Okay? Okay, here we go. You ready? Put it. Okay. Okay, and now I'm gonna add this lemon to it, and we know why. We already know why I'm doing that, okay? Okay, here you go. Ready? Okay, that's the garlic. And that's to, vampire slots. Yeah, it had to be checked. I'm sorry. I'm sorry. It had to happen. Okay. And here we go. What I'm gonna do is I'm going to put this right under here.
And what I want you to hear is I want you to hear the slow, mellow sound of the herbs being mixed together, okay? Okay, here we go.
I want this to soothe you, calm you, and relax you. Okay? Okay. Now I do have what's called Warren pestle. And I'm using this because these ingredients need to be eaten whole. The goblins' toenails are gonna be like tablets. So I'm going to let the ingredients soak it up, and you have to eat it each toenail. Okay? That's good. Okay, now I'm also going to use these. And what I'm going to do with these is I'm going to try it, okay? I'm going to use them to spell cast over the potion, okay? Yeah. What I'm using is an opalite for the white knights and white warrior princesses. And I'm using a bloodstone for the dark knights and the dark warrior princesses. What we're going to do is we're going to combine them together. Okay. Okay. Now you're prepared. And, okay. I'm going to take one more sample from the side of your head, just to make sure that we got all the creature out. Okay? I hope you don't mind. Like I said, just tell me if you're uncomfortable at any time. Okay, here we go. Okay. You ready? Come here. Come here. Okay, lay your hands to the side. Okay, perfect. You're doing so good tonight. Okay, now I've got the sample extracted, and here we go. I'm gonna put it on the slide, like so. And we're gonna go ahead and take a look, okay? Don't worry.
I do believe you're gonna be just fine.
Okay? Alright. Would you like to take a look? Go ahead. You see it? Okay. Now, right now you're looking at the clean slide. And let me put the slide in that had the fragments from the earlier so that you can see exactly what I removed. And that's just a fragment of it. I know it looks like a mosquito, but it's not. But mosquitoes do carry them, so you know, it could be. I don't know. I was just showing you. I'm gonna look and make sure. Yeah, from what I could see,
From what I could see, it was a very clean slide.
Okay. Okay. No. Let me look. Hold on. Hold on. Okay. It looks really good. It looks great. Hold on. Okay. Very good. Very good. Okay. You're clean. Now, what we're going to do is I'm going to give you your diagnosis chart. What I would also like to send you off with is this. Now, this is very important for you, okay? Please.
This is called a psychic detox.
Okay?
Very, very good for you. Very good for your psyche. Very good for everything. Okay? And it's a psychic detox.
Okay? Okay. I'm gonna message you down with it. And I would like
it very much if you took this with you.
Okay. Okay, now let's spray it. And what I'm going to do is I'm going to spray the entire area. Okay? And as far as you're concerned, have some more of this detox tea. Okay? You've been through a lot tonight. Very good. Okay, now. Let's make out your thing. Here. Yeah. Okay. Let's fill this out. Okay. Very good. Okay. So in addition to all the tests that you've passed, you've had a fireworm extraction. Yeah, which is now clean area. Okay, you've been detoxed. What else? Okay, so parasite extraction is complete. You've been detoxed. Okay. What else do we have? Oh, inside and out detoxification program. So I think that you're really good to go. And the next time I see you, what I would like to do is I would like to fit you with chainmail and prepare you for battle. Okay? Okay. 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 Alright, that sounds great.
Okay, let's bathe you in some ink light now.
Are you sleeping? Can I hypnotize you? ready? Okay. It's kind of hot down here, see? But it's okay, because I'm sharing tea with you, and so
that makes me happy.
Okay? Now, here's what we're gonna do. I don't want any banging. I'm trying to do this very lightly. Okay? And I know I shouldn't leave the camera and stuff right now. I work, you know, whatever. Warrior Princess has to work. Okay? Alright. Because I have to heal you. You ready? We're gonna do some pink light. I was ready for this time. Because last time, this thing got really hot. Okay. There we go. I'm trying to get it. It's got some turning. Okay. Alright, excellent. Now we're gonna do. Okay. Now, are you ready? I hope you feel better. Okay. The dungeon is so pretty, isn't it? Okay, here we go. Okay. Ah, pink light, as promised. Okay, everybody, what I want you to do is I want you to completely relax. I want you to close your eyes, and I want you to know that you did a wonderful job tonight. You passed your test, like, all across the board. Your eye exam was just amazing. Your olfactory, it works great. Your sense of taste, smell, you're all good. And on top of it, we removed the fireworm. Okay? Okay, so here we go. Now, what I'm gonna do here. Okay, here we go. Now, if any of you still have your eyes open, what I want you to do is close them. And I'll be saying goodnight on my next video to all my warriors that commented on the last video and this video. So we're gonna have pretty extensive goodnights after the chainmail fitting and the war paint. But hey, that's fun. You ready? Okay. Relax. Breathe in through your nose. Out through your mouth. In through your nose. Out through your mouth. I want you to make yourself as comfortable as possible. I want you to let your head lay back on your pillow. I want you to, if you still have your eyes open, to focus on the amulet in front of you. It's going to start at a gentle sway. Okay? Alright. And it's going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, what I'm gonna do is I'm gonna count backwards from 10, okay? And when I hit 1, you'll be asleep. You ready? Okay. I'm gonna start the process over again.
Just so that we're both clear on exactly what's going on here, okay? Okay, let's start the process over again. I want you to completely relax. I'm gonna miss some more psychic detox right here. Here. Okay. We hear it sizzling in the candle. Okay. It's purifying everything. Everything's just gonna be purified for you. your mind, your body, your soul, everything, your eyes, everything. It's just gonna be pure and clean. You're gonna relax and you're gonna oxygenate yourself by breathing in through your nose and out through your mouth. In through your nose and out through your mouth.
Okay? You're gonna completely relax because your state of mind. Okay? It's very important. Okay? And here we go. Are you ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, everybody, here we go.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You should be sound asleep now. Your mind should be at ease. Your body at ease. Everything should be completely relaxed and at ease now. Okay? We got all the things out of your head that are bothering you. But we're gonna come back and take care of more. Okay? I'm gonna completely take care of you. Okay? But for the time being, you did a wonderful job on all of your exams, and you've completely passed everything. So, yeah, relax. Alright, everybody? Okay. And what's the rules, warriors? Keep the faith. Peace. Good night, everybody. Love and light.